Hello, this is Professor Werwath. I wanted to share with you my interactions with ChatGPT and in particular Microsoft Copilot. I'm using GPT-5 at the moment. I wanted to explore how to use this tool, in particular to diagnose problems I've had with my back. Recently, I had an MRI, and frankly, I got my report back from the MRI on my spine, which was a follow-up from what was done apparently 8 years before, because obviously this is not something that's sudden. It's something that's been so I've wrestled with, and in the past I've done chiropractic and a whole bunch of other things. Um, so let's get started. I'm going to cut and paste into Copilot my analysis of the MRI that came from my doctor. But before I do that, let me start with the prompt. Please prepare let's say instead, please advise the best course of treatment for a 65-year-old male with the following spinal condition. I've just cut and pasted here a whole lot of information that, frankly, unless you're a physician, probably doesn't make a whole lot of sense. S1, S2, T11, T12, fatty deposits, arthropathy, et cetera, et cetera. Doesn't mean that much to me. I'm just an engineer. So let me see what AI can tell me about what they would recommend as the best course of action and treatment, right? Posture training, physical therapy, medications, steroids, lifestyle. Okay. Doesn't sound too aggressive. What role can surgery play to improve the prognosis? Oh, sorry. I guess I missed it. It was already here. So after lifestyle, it says indicated if there's progressive deficits like weakness, severe pain, significant functional limitation, laminectomy, forainotomy, fusion, etc. Okay. It says my long-term prognosis is that symptoms will progress over time. Surgery might give me good relief for leg pain, but less so for the back pain. Let me ask about chiropractic. So I'm kind of curious why chiropractic. What role would or could chiropractic play in treatment? All right, let's see. Benefits: it's non-invasive, it's drug-free, it does manage your symptoms and reduce pain. It is a good adjunct. It's not a cure, not for severe neurological deficits, requires a skilled practitioner. Improper manipulation can worsen symptoms. Wow, okay, that's not good. I've heard of something called RFA. What role can RFA play in I guess, a treatment plan for this patient? This is radio frequency ablation. Okay. It targets the branch nerves, applies heat via radio frequency. It's not a structural fix. It does not decompress the spinal canal. It doesn't correct the congenital short pedicles. It's for symptom control. Pain relief duration can last up to 18 months, maybe 2 years. Repeat procedures may be needed. 50 to 80% pain reduction. Minimally invasive. Roll in a comprehensive plan. Okay, who in the Endeavor Health group in Illinois can perform this procedure? We're looking at the procedure here, radio frequency ablation. Evanston Hospital, Skokie Hospital. Let's see if we can find a specific doctor at Endeavor Health. Huh, it bounced me out. Okay, well, at least we know that they can do it at these hospitals. Which doctor is known for RFA in Northern Illinois? Okay. Arlington Heights and Libertyville. Paul Marsiglia and Demetrius Lewis.
If that wasn't right, just say, Alexa, remove that.
Okay, so it looks like I've got some options here. How would you compare RFA with chiropractic here versus physical therapy for this patient? So apparently all three are pretty low risk. Maybe RFA might be the way to go. Maybe physical therapy, maybe chiropractic. Here's a nice little summary table. I guess if I'm interested in strength and function, physical therapy might be the way to go. If I'm worried about pain, maybe RFA is the way to go. Huh. They say physical therapy is potentially long-term. RFA is going to last maybe 18 months. Chiropractic is short-term. So do I want a combined treatment algorithm? Yes, I do want to see a combined treatment algorithm. So I start with physical therapy. I move on to chiropractic. I move on to RFA. And then step 4 will be surgical considerations. Okay, so this is a progressive approach, right? So I took a whole bunch of information that I had available to me from my doctor, from an MRI. It was literally what the doctor had put in my chart, my electronic chart. I cut and pasted that into ChatGPT 5. I asked it a series of questions that were cumulative, digging deeper and deeper. And now I've got what looks like a pretty comprehensive plan of attack that is, I guess, low risk, right? Building on, I guess, these low risk components, adding a little bit of risk and a little bit of functionality at each step. So I go from physical therapy to chiropractic to RFA. So the purpose of this was to show this is how you can interact today with ChatGPT, with generative AI, as almost a consultative physician of sorts, right? It basically was answering my questions as I went, and it was giving me advice as to what the trade-offs are between the various options, interpreting my situation as best it can with the information I gave it. So hopefully that gives you a sense of how AI can interact with patients in a cumulative way, especially in fuzzy areas that actually have multiple treatment options that may have different trade-offs that, depending on your age and circumstance and what your priorities are. If I'm sitting here in agonizing pain, I think I might skip straight to RFA, right? If I'm more interested in retaining or progressing my strength and my agility, I think I might start with physical therapy. So it all depends on what my priorities are, right? Which is good. I think it gave me a level of detail that most MDs, most physicians either don't have time for or may not even have all the full breadth of knowledge to do this. So let me know what you think. So I'll put some comments down, and I appreciate your time today. Thank you.